I'm Dr. Matthew Schulman, board certified plastic surgeon, and welcome to another episode of Ask Dr. Schulman. Today's question is, why do I have an Audi belly button? Despite what people think, the shape of your belly button has nothing to do with how the doctor tied your umbilical cord. It's really not that at all. The reason you have an Audi belly button is most likely you have a hernia. So what is a hernia? A hernia basically just means an opening, a hole. So if you have a hernia in your belly button, it means there's a hole underneath your belly button and there's something poking through. That something is usually a piece of fat that's on the inside of your abdomen, or sometimes a piece of intestine. So that's pushing through and making your belly button an Audi. Now, why do we have that hole? That hole is not abnormal. The hole is something we all have as babies. That's where our umbilical cord goes through. So the umbilical cord from the mother to the baby goes through that opening in the abdominal wall in order to give blood and nutrients and nourishment to the developing baby. By definition, every single baby has that hole, but it tends to close in 80% of people by the time they're 2 years old. So most of us, that hole has closed and we don't have an Audi. Now, in people where that hole remains open, you will have an Audi belly button. And that may be really large when you're a baby, or maybe it comes later in life. Commonly, with weight changes or pregnancies, that can force things through that small opening. So that's why you have an Audi belly button. It has nothing to do with the way the doctor tied your cord. It has to do with the fact that there's a hole and something's pushing through. So what can you do if you have an Audi belly button? Well, the easy answer is you can do nothing. Maybe it doesn't bother you. Maybe you like it. There are certainly people out there that prefer the appearance of an Audi belly button. But if you're someone that has an Audi and prefers to have an Innie, there are small surgical procedures that can correct that. The surgical procedure would have to involve fixing the hernia, so closing that hole so that nothing can poke through anymore, and also doing some cosmetic work on the belly button itself. That second part of the procedure is really important, and I find that if you only fix a hole but you don't fix the skin of the belly button, then what happens is you have no hole and just some loose skin on top. So technically there's no hernia, there's nothing pushing out, but you just have some extra skin. So as a plastic surgeon, I will be able to fix the hernia, so close the hole, and do the cosmetic work on the belly button to give you a nice Innie. That is what we call an umbilicoplasty. In many people, this umbilicoplasty can be done under just local anesthesia. So we do this in my procedure room. I numb up the area with some local anesthetic so you won't feel anything, and then I can fix the hernia, so fix the hole, remove the skin, and make the belly button look like a nice Innie. So that's a procedure where it's a very rapid recovery. You can return to normal things really quickly, and the scar is actually hidden nicely within the rim of the belly button. So if this is something you think would interest you, then reach out, give us a call, and we're happy to evaluate you and see if you are a good candidate for an Audi to Innie procedure or an umbilicoplasty. Thank you for joining me for another episode of Ask Dr. Schulman. If you like this, make sure to like, comment, and share. And again, subscribe to my channel because more videos like this are coming out all the time.